Thank you very much for scheduling your free policy review call with your agent here at the Medicare Man, home of Highway 65 Insurance. Policy review calls are extremely important because it allows us to accomplish three things. The first is to update you on major changes in Medicare for 2026 and how those changes might impact you personally. The second is to review your current policy to make sure that you have the coverage that you want at the best available price. And then the third thing is to review your package of protection and uncover any gaps or major exposures that you need to be aware of. Now, the purpose of this video is to prepare you for your scheduled call. I encourage you to take out a pen and piece of paper and write down what you want to accomplish during your call with your agent. That way, we can make sure that you get the most out of your scheduled call. Now, the first topic is going to be updates on Medicare for 2026. So that's going to be the new Medicare premium, income adjustments that are attached and added to that premium. And if you're charged any income adjustments, they will review to see if you qualify for a life event that can avoid or reduce or even eliminate those income adjustments. That's very important. Next, the agent is going to update you on changes in Medicare Part D, the prescription drug coverage in 2026. They're going to make sure that you know how to use the Medicare.gov plan finder in preparation for the upcoming enrollment period. And lastly, the agent is going to make sure that you are aware of all the preventive services that are available to you covered at 100% because you want to take advantage of those preventive services and stay healthy. Next, the agent is going to review your Medicare supplement plan. Now, supplement plans are standardized, so you don't want to pay more for it than you have to. In order to review your supplement plan and look at options that are available and how much money you can save on the exact same coverage, the agent's going to need a little information on your recent medical. So have your medication list and recent medical available. Then the agent is going to review your package of protection to make sure and uncover any major exposures or gaps that you might have in your coverage. Now, the most common gaps that we run into would be number one, the big three: cancer, heart attack, stroke. Okay. Now, regardless of what plan you have in place for your Medicare, cancer, heart attack, and stroke, those are expensive diagnoses. They very frequently come with unexpected out of pocket expenses, and there are ways to fill that gap that the agent will share with you. Next, and probably an even bigger issue, is skilled nursing or home health care. Okay. This major exposure often goes unaddressed, and we want to make sure that you're aware of how Medicare works with skilled nursing facilities. Well, to make it long story short, the most you can have covered by Medicare with skilled nursing is 100 days. And there's some hoops to jump through in order to even get that covered. But assuming that the 100 days is covered on day 101, you're on the hook for 100% of the bill. There's only two ways to have that paid for. That's either out of your assets, so your savings, your retirement funds, okay, or you have a plan in place. And the agent's going to share with you some of the ways that we can have that gap filled for you. Now, that should have you prepared for your call. So write down your questions and concerns, and then the agent's going to take you through those three steps to make sure that you're well taken care of. We very much appreciate you choosing the Medicare Man, home of Highway 65, to be your Medicare insurance agency. Thank you very much. Have a great day.